Good morning, good evening, good afternoon, everyone. Welcome to Health Talk by Dr. Mike. How are you, viewers, subscribers, and followers? Where we delve into the cutting edge advancement in science and medicine. For today, I know you are all excited about this one. We have a fascinating topic on the agenda: gene therapy and its potential in treating cardiovascular diseases. I know most of you are so interested, so excited to have this topic, particularly when we talk about cardiovascular diseases, isn't it? Some patients having heart diseases, some have myocardial infarction, and it is considered one of the leading causes of death in the world. So I think it's appropriate to discuss this topic and what is gene therapy all about. But before we discuss this topic, let me introduce to you guys our guest for tonight. Take note, we have a guest to discuss all about this gene therapy. This is much exciting, I think, for all of us. So our guest, let me share the profile of our guest. So we have Dr. Wei Yi Ivy Sian. She graduated BSc in pharmacology at McGill University, and then she moved to the University of Hong Kong to study Master of Public Health in Biostatistics and Epidemiology, and then moved to Poznan University of Medical Sciences for her Doctor of Medicine, then became a research assistant at HKU, then transferred to Hong Kong Polytechnic University for her research associate program, and then, take note, a co-founder of the X Biotech startup company. And without any further ado, please welcome Dr. Ivy. Hello, Dr. Ivy.
Hi everyone, my name is Ivy. It's really a pleasure to be here.
I'm so excited to have you in our program, Health Talk by Dr. Mike. And to start off, could you give our audience a brief overview of what gene therapy entails, especially in the context of cardiovascular diseases?
Yes, of course. So basically, gene therapy it involves introduction, alternation, and removal of the genetic materials in a person's cell to treat or prevent a certain type of disease. So in the case of cardiovascular disease, this will mean that it will target cells or genes that involved in heart functions or blood vessel formation or cholesterol metabolism. Um, yeah, I think that's a very brief summary of what gene therapy is about.
Wow, I'm so amazed about this one. And this one sounds promising. Could you share some recent advancement or breakthroughs in gene therapy, especially tailored made for cardiovascular disease?
So basically, in the recent years, there has been a lot of exciting development in the area. So, for example, researchers have been exploring gene editing techniques, like I guess some of you might have heard of CRISPR-Cas9, which is it will precisely modify genes that associates with heart health. And also, there are ongoing clinical trials testing the efficacy of gene therapy to target specific cardiovascular condition, such as hypercholesterolemia, which is just a fancy term for having a lot of lipids, like fat in your body, or like other type of for example, heart rhythm disorders. So like when your heart is not beating normally.
Oh, wow, that's great. And that's fascinating. Could you elaborate on how these gene therapies work and what potential benefits they offer compared to the traditional treatments?
Yeah, so gene therapy for cardiovascular disease, they usually focus to address an underlying gene abnormalities or like deficiencies that will contribute to the development or progression of the condition. So then by targeting the specific genes, we can potentially correct or let's say mitigate the root cause of the disease. So this can offer more targeted and potentially long-lasting treatment effects comparing to the treatments that we have right now. Because what we have right now is mostly medications or surgeries, and a lot of the times it's not treating the fundamental cause, but focus more on the symptoms.
Oh, I see. And it sounds like gene therapy holds great promise. However, there may also be some challenges and considerations regarding this. Could you shed some light on the potential limitations or risk associated with gene therapy in the context of
Mhm.
cardiovascular diseases?
Yes, yes. So while gene therapy offers very exciting possibilities, as I just mentioned earlier, there's
Mm,
definitely challenges to overcome. Um, so this includes safety and efficacy of the treatment, and we have to think about the ethical considerations, um, since we're dealing with gene, which is like the fundamental part of um, how like we are as a human. And
mm,
then we also have to address like practical issues, like how do we deliver um, to
mm.
like how do we deliver the gene product to the body, and also like the immune response the body might generate when having a foreign particles in the body. And additionally, long-term follow-up studies will be very important to monitor any potential side effects or complications.
Mm. So those are important points to consider. And looking ahead, what do you envision for the future of gene therapy in the treatment of cardiovascular diseases? Are these, or are there any emerging trends or areas of research that you find particularly promising?
Mhm. So personally, I believe the future of gene therapy in cardiovascular disease is like incredibly promising, because researchers are continuing to refine the existing techniques. So then, in other words, it is to like to make the techniques better, and then we're also exploring new delivery methods and identifying new gene targets for intervention. And also, there's also advancement in like personalized medicine and precision genetics are also opening up other possibilities for tailoring gene therapies to individual patterns of genetic profile. So this will potentially maximize the efficacy while minimizing the risks and the side effects of the treatment.
Oh, I see. I am aware that your company is exploring AAV9 dash CTNT mediated gene delivery. Could you provide our audience with some backgrounds on AAV9 dash CTNT and its significance in the field of gene therapy?
Yes. So AV9-CTNT, it's if we elaborate on this, it just stands for adeno-associated virus, serotype 9, and it does sound complicated, but essentially, it's just a virus that um that can carry
Mm-mm.
like other materials. So like CTNT itself, it's a
Mm,
type of um triponent like promoter. And
mm,
so when they're combined together, it's a viral vector
mm,
that's engineered to target cardiac tissue specifically.
mm.
And the use of CTNT itself will allow for selective gene expression in the heart cells. And this will make it very ideal for delivering this specific gene to the heart.
Oh, I see. That's fascinating. How has AAV9-CTNT contributed to the advancement of gene therapy in treating cardiovascular diseases?
I believe so far it has made a very like significant contributions to the treatment of cardiovascular disease, particularly in conditions such as heart failure. And by delivering therapeutic genes directly to the heart, AAV9 CTNT can enable targeted intervention to address the underlying molecular and also cellular abnormalities associated with heart failure. So as far as we know, AAV9 CTNT has already been approved in FDA in the States, and it has showed very promising results in preclinical studies and early clinical trial with improvements observed in cardiac functions and also patient outcomes.
Oh, okay. That's remarkable. And can you provide some examples of how AAV9-CTNT has been utilized in gene therapy research for cardiovascular diseases?
Yeah, so apart from what I mentioned, how it has helped with heart failure, so more specifically, like there are like researchers have identified genes that encodes for protein involved in like calcium handling, contractility, or angiogenesis, which is like forming vessels.
Mm-mm.
So um, so this kind of like proteins have already been delivered using AAV9 CTNT to enhance the heart function and promote the regeneration of heart cells.
Mm-mm.
Additionally, AAV9 CTNT have also been investigated as a delivery vehicle for gene editing technologies, such as CRISPR-Cas9, which is what I mentioned earlier. And it was used to correct the genetic mutation associated with inherited cardiac disorders.
Oh, I see. And it sounds like AAV9-CTNT holds a great promise for the future of gene therapy in cardiovascular medicine. Are there any challenges or limitations associated with its use?
Yes, as far as we're like so excited about all the potential opportunities that's there, there are of course challenges to overcome, and this may include like optimizing the vector design for enhancing um, like cardiotropism. So that's like um, basically like to get the gene to the target precisely, and also to minimize the immune responses to the viral vector, and also to ensure long-term safety and efficacy of the gene therapy intervention. And also like cost effectiveness is very important.
Mm.
Um, and I think like I realize I've talked about it in such like perhaps in such a scientific way. So I
Mm.
just want to make it more like easier for the audience to understand what AAV9 and CTNT really is. So like
Mm.
if we just visualize that there is a maze in front of us and we have to go from um, point A to point B through this maze, and imagine the maze is it just represents our body. So essentially the gene we have to carry is at point A, and
Mm.
then AAV9 will be it will be like a truck, like a car
Mm.
that's carrying this gene
Mm.
to point B, and it has to go through like all the blood vessels and everything. But then because we know our body is such a complicated system, so
Mm.
how does it make sure that it will reach point B like specifically? That's why
Mm.
we need like a GPS system, which is what CTNT is like.
Oh,
So
I see.
I
Yeah.
hope that gives a more like that will provide an easier
Okay.
way to like understand this whole concept because it is quite new. Yeah.
Yes. Thank you for pointing that out. And thanks for highlighting those important points. Because I think our viewers, particularly laymen watching us or listening us tonight, they are looking ahead for this one. And what do you envision for the future of AAV9-CTNT and gene therapy in cardiovascular medicine?
I think overall, we just have to further refine how the vector is designed and how we can deliver it better to avoid any immuno responses. And something that was very like um that's like a hot topic as well as
Mm,
personalized medicine, which means that we're trying to get therapeutic strategy tailored to individual patients' needs. So that's
mm,
something that can also be combined in
mm,
this gene therapy. And auto um alternate. Okay, no, sorry, I can't pronounce at this moment. So
mhm,
basically, what I was trying to say is that I'm very optimistic that gene therapy will offer new hopes for patients with cardiovascular disease.
mm,
And I don't think it's something that we will achieve in like a few months or like 1 year or two. Like
mm.
it's probably in the long term. But it's nice that we're actually like doing it. And um, so then eventually the aim is to improve outcomes and quality of life in our patients. Yeah,
Okay.
so I think like we're all in the, sorry to interrupt you, but yeah,
Yeah, sure, sure,
um,
sure. Go on, go on.
I think we're in a really good like journey.
Mm-mm,
Like I think we're like if I can put it in a way that's more so I think like we're in
mm-mm,
the
mm-mm,
Christ of a cardiac journey of
uh,
revolution,
mm-mm.
if that makes sense.
Yes, yes, I do understand that one. Particularly these personalized treatment options that you would be providing in the future for, again, bottom line is about the quality of life, the future at stake for our patients who would be suffering from cardiovascular diseases in general. Thank you for sharing your expertise and insight on this important topic. I believe that all the viewers watching us for tonight, they are very optimistic as well to have this. It is clear that AAV9-CTNT has the potential to revolutionize the field of gene therapy in cardiovascular medicine, and we look forward to seeing how this research progresses in the future. And Dr. Ivy, do you want to add more?
um, I think that's everything that I wanted to say. Yeah, I hope that the audience will enjoy this because it is a very interesting topic, at least to myself.
Yeah.
And yeah, thank you for having me today.
Do you want to say thank you also to someone or your group? Uh,
Oh
like,
yes, yes.
yeah.
So I think like I was really lucky to be able to start this X biotech startup company with my teammates and my supervisor, Dr. David Tsai. And we're a very new startup, but
Mhm.
we are hoping that we will achieve a lot more in the coming future. And I would like to give acknowledgement and thanks to the university, the Polytechnic, the Hong Kong Polytechnic University for giving us the support because that's how we started this whole thing and how we actually trying to translate our research into the field.
Yeah, congratulations. And I've heard that you also won the Health Future Challenge in 2023. Congratulations.
Thank you.
Okay, so thank you so much to our guest, Dr. Ivy, for sharing her insight about gene therapy. And on this very, very fascinating topic, it's clear that gene therapy holds a tremendous potential in revolutionizing the treatment of cardiovascular diseases. And thank you to our audience for tuning in, for watching us in today's episode. Stay tuned for more groundbreaking discussion here at Health Talk by Dr. Mike. Don't forget, every Wednesday, Friday, Sunday, we are live here at YouTube. Health Talk by Dr. Mike, 9:30 in the evening. Or you can watch us also if you have Facebook page, Health Talk by Dr. Mike, every Tuesday, Thursday and Saturday, 9:30 in the evening. So once again, Dr. Ivy, thank you so much. Hope to see you again for our next episode. And we are waiting for what would this research would bring us about towards healing patients related to cardiovascular diseases. Okay? So Dr.
Thank
Ivy,
you.
thank you.
Thank
Bye.
you. Bye.
So, ladies and gentlemen, that's the end of our blog. See you in our next episode. Have a great day, everyone. Bye.